There were no doctors, no hospitals, no pharmacies with neat rows of labeled bottles, no medical textbooks explaining what was wrong with you or what to do about it. If you were injured or sick or in pain, there was no one to call and nowhere to go, except whatever knowledge the people around you happened to already carry in their own memory. And yet, somehow, humans figured it out. Somewhere in that world, without instruction manuals, without laboratories, without any understanding of what a bacterium or a virus even was, someone discovered that a particular root eased pain, that a certain leaf, chewed and pressed against a wound, seemed to help it heal instead of fester, that some plants, eaten in the wrong amount, could kill you outright. How does that happen? How does a species with no scientific method at all begin to build something that eventually became medicine? The answer is not a single moment, and it is not one brilliant individual. It is something far stranger and far more human than that. It is the story of an enormous, slow, largely invisible accumulation of trial, observation, memory, and survival, stretched out across an almost unimaginable span of time and pieced together by researchers today using clues that are, more often than you might expect, written directly into bones, teeth, and the dirt itself. To understand how this process could have even begun, you first have to picture the world early humans were actually living in. Injury was not rare. Hunting large animals, encountering predators, falling on uneven terrain, cutting yourself while working stone or bone into tools, all of this happened regularly, and infection following an untreated wound could easily become more dangerous than the original injury itself. Illness, similarly, was not something that could simply be waited out with confidence. Some conditions resolved on their own. Others did not. Given this constant repeated exposure to injury and illness, early humans were also constantly, if unintentionally, running a kind of long-term natural experiment. Something happened. Someone did something, deliberately or by accident, and an outcome followed, sometimes helpful, sometimes not. Researchers studying the origins of medical knowledge argue that this repeated cycle of experience and outcome, played out across countless individuals and countless generations, is the most plausible foundation for how early medical knowledge began accumulating at all. This is a reasonable framework grounded in how learning and knowledge transmission generally work, rather than a directly observed historical record, since no one was recording these individual moments as they happened. One of the most interesting and actively discussed hypotheses connected to this question involves observation of the natural world itself, not just other humans, but animals. Researchers studying animal behavior have documented numerous cases of wild animals apparently selecting specific plants when sick or parasite-infested, plants they do not normally eat, sometimes containing compounds with genuine anti-parasitic or medicinal properties. This behavior, sometimes referred to by researchers as zoopharmacognosy, has been observed in various primates and other mammals. It is a genuinely fascinating area of ongoing research, and some researchers have proposed that early humans, living in close daily contact with the natural world and almost certainly paying close attention to the behavior of the animals around them, could plausibly have noticed and eventually copied this kind of behavior. It is important to be clear that this remains a compelling hypothesis rather than a directly proven historical event, since there is no way to directly observe whether any specific ancient human population actually learned about a specific plant this way. But the underlying logic, that careful observation of the environment, including animal behavior, could plausibly have contributed to early plant knowledge, is scientifically reasonable. What is considerably more certain, because it is based on direct physical evidence rather than reasoned inference alone, is that early humans were consuming a wide variety of plants long before recorded history, and that at least some of those plants carried genuine medicinal properties, whether or not the people eating them fully understood why. One of the most striking pieces of direct evidence comes from the analysis of ancient dental calculus, the hardened plaque that builds up on teeth during a person's life and can trap microscopic particles of food and other substances for an extraordinarily long time afterward. Researchers analyzing dental calculus recovered from Neanderthal remains at Shanidar Cave in Iraq identified plant residues including chamomile and yarrow, two plants that notably tend to taste bitter and offer little obvious nutritional value, which has led some researchers to propose they may have been consumed specifically for their medicinal or pharmacological properties rather than simply as food. This remains a genuinely debated area of research. Some researchers argue the bitter taste and known properties of these plants make deliberate medicinal use plausible, while others caution that we cannot be completely certain the plants were not consumed incidentally, perhaps present in the stomach contents of animals being eaten, or ingested for reasons that had nothing to do with treating illness. Both are reasonable scientific positions given the limits of what dental calculus alone can definitively prove, and researchers studying this evidence are careful to present it as suggestive rather than conclusively settled. Physical evidence for deliberate wound treatment becomes considerably clearer once we look at skeletal remains showing evidence of healing after serious injury. Archaeologists studying ancient skeletal remains have documented numerous cases of broken bones that healed with proper alignment, a pattern that becomes especially interesting when the specific bone involved would have made basic survival tasks like walking or gathering food extremely difficult without some form of assistance or care from other members of the group during the recovery period. Researchers studying these cases argue that surviving a serious fracture in a prehistoric environment, one healed well enough to leave a clean, aligned mark in the bone rather than a poorly set, twisted deformity, strongly suggests some form of intentional care, whether that meant simply being fed and protected by others during a lengthy recovery period, or something closer to active treatment such as immobilizing the injured limb. Some researchers have also pointed to residue and wear patterns found on certain sharpened stone tools as possible evidence of early wound care, since the same type of small, precisely shaped blade used for skinning game or working hide could plausibly have also been used to clean debris from a wound or to lance an infected area. This remains a more cautious, indirect line of evidence than the skeletal fracture cases, since a stone tool's edge alone rarely reveals with certainty exactly what it was used for on any given occasion, and researchers are careful not to overstate what a single tool can prove about medical intent on its own. This connects to a genuinely remarkable and considerably more dramatic category of ancient medical evidence: trepanation, the deliberate practice of cutting or drilling a hole into the skull. Archaeologists have recovered trepan skulls from numerous sites around the world, some dating back more than 7,000 years, and a substantial number of these skulls show clear evidence of new bone growth around the edges of the hole, meaning the person survived the procedure, sometimes for years afterward. This is direct, physical, unambiguous evidence, not inference. Someone deliberately cut into another living person's skull using a stone tool, and the patient lived. Why early humans performed trepanation is considerably less certain than the fact that they did perform it, and researchers are careful to separate what the physical evidence definitively proves from what remains reasonable speculation about motive. Some researchers propose it may have been used to relieve pressure following a serious head injury, a use that would have at least some grounding in genuine physiological logic, since severe swelling inside the skull following trauma is a real and dangerous medical problem. Other proposed explanations involve treating severe, persistent headaches or seizures, conditions with symptoms that could plausibly have been interpreted, correctly or incorrectly, as requiring some kind of physical intervention inside the skull itself. Without written records from the people who actually performed these procedures, researchers cannot say with certainty which explanation or which combination of explanations is correct for any specific ancient case. And honest historical accounts of trepanation are careful to acknowledge this uncertainty directly rather than presenting any single explanation as a settled fact. Alongside evidence for treating serious trauma, there is also direct physical evidence for something that sounds almost startlingly modern: ancient dentistry. Researchers studying a 9,000-year-old skeleton from Pakistan identified drilled holes in several teeth, consistent with an early, remarkably sophisticated attempt to remove decayed material, using tools that were most likely simple flint drill points. In a separate, similarly striking discovery, researchers examining a roughly 6,500-year-old jawbone from what is now Slovenia identified a tooth that had been filled with beeswax in a location and pattern consistent with an intentional attempt to reduce pain and further decay in a cracked tooth. This is confirmed. Physical, chemically verified evidence, not speculation. And it demonstrates a level of applied practical problem-solving around a specific painful medical condition that many people do not associate with populations living this far back in prehistory. Plant-based treatment, meanwhile, appears to have continued developing in parallel with these more invasive procedures, and one of the clearest examples connecting ancient practice to a substance still recognized today involves willow bark. Willow bark contains a natural compound called salicin, which the human body converts into a substance chemically related to the active ingredient found in modern aspirin. Historical written records from ancient Egypt and ancient Mesopotamia describe the use of willow bark and willow leaves for reducing pain and fever, and this represents a genuinely fascinating case where a specific plant-based remedy, refined and passed down for an extraordinarily long period of time through direct observation and generational knowledge transfer, was eventually confirmed by modern chemistry to actually contain a real, measurable, pharmacologically active compound. It is worth pausing here to be honest about an important distinction. Some ancient remedies, when studied using modern scientific methods, turn out to contain genuinely active compounds capable of producing a real physiological effect. Exactly the kind of outcome that would explain why a particular plant kept being used generation after generation long enough to eventually become deeply embedded in a community's accumulated medical knowledge. Other ancient remedies, when tested using the same modern scientific standards, show no measurable physiological benefit at all, and may have persisted in use for entirely different reasons, including genuine coincidence, the placebo effect, cultural or symbolic significance, or simply because an illness that would have resolved naturally on its own happened to resolve after the remedy was administered, creating an understandable, though ultimately mistaken, impression of cause and effect. Distinguishing clearly between these two categories, remedies that work for verifiable chemical reasons and remedies that persisted for other non-pharmacological reasons, is a critical part of how historians and researchers responsibly study the history of medicine today, and it is important not to blur that distinction in either direction. As scattered, empirical, trial-and-error knowledge accumulated across countless generations, at some point it began to be organized, recorded, and formally systematized rather than existing only as informally transmitted oral tradition. Some of the clearest, earliest written evidence for this kind of organized medical knowledge comes from ancient Mesopotamia and ancient Egypt. The Egyptian document now known as the Ebers Papyrus, dated to roughly the 16th century before the Common Era, though widely believed by researchers to contain considerably older material copied and compiled from earlier sources, describes hundreds of specific medical conditions, along with corresponding treatments involving an extensive range of plant, animal, and mineral substances. This represents a genuinely significant shift, not because medical knowledge suddenly appeared from nowhere, but because it marks a clear, confirmed transition from purely informal, orally transmitted knowledge towards something increasingly organized, deliberately recorded, and systematically taught to others through written instruction. Ancient Mesopotamian medical texts, inscribed on clay tablets using cuneiform script, similarly describe specific diagnoses paired with corresponding treatments, and some tablets even distinguish, at least in practice, between what researchers have described as more empirically grounded, symptom-based treatment approaches, and separate practices more closely tied to broader cultural or ritual beliefs of the time, illustrating that even in some of the earliest formally recorded medical traditions, multiple different approaches to understanding illness appear to have coexisted side by side rather than functioning as a single, unified system. It is worth stepping back at this point to genuinely appreciate the scale of what had to happen for any of this organized written knowledge to exist at all. Someone at some point, almost certainly by accident rather than deliberate design, discovered that chewing on a piece of willow bark reduced pain. Someone else, entirely independently, likely discovered that pressing a specific plant against an open wound seemed to reduce infection compared to leaving the wound completely untreated. Someone else again discovered, probably through a combination of desperation and outright accident, that cutting into a swollen skull could sometimes relieve severe pressure and allow a patient to survive an injury that otherwise might have killed them. None of these represent a single unified body of knowledge invented all at once by any one person, or even by any one community. They represent countless separate, scattered discoveries made independently across different populations, different environments, and different points in time, each one surviving only because it was remembered, deliberately taught to someone else, and considered valuable enough to be worth passing along to the next generation. This is precisely why the story of medicine cannot honestly be told as the story of a single inventor. It has to be told as the story of an enormous, distributed, largely anonymous collective effort spanning tens of thousands of years in which the vast majority of individual contributors are, and almost certainly will always remain, completely unknown to us. We do not know the name of the person who first discovered that willow bark reduced pain. We do not know the name of the first person who successfully performed a trepanation and watched their patient survive and recover. We do not know the name of the person who first noticed that a specific bitter plant seemed to ease the specific symptoms of a specific illness. All we have, in most cases, is the accumulated result of their discoveries, echoing forward across an immense span of time, preserved in bone, in ancient plaque, in clay tablets, and eventually in the written medical traditions that gradually, unevenly, and never all at once began to more closely resemble what we would recognize today as organized, systematic medicine. What began as a desperate, urgent, deeply practical response to injury and illness, driven by nothing more than the basic need to survive, eventually grew, through countless small, scattered, and largely unrecorded acts of observation and experimentation, into something considerably larger. Each generation added a small amount to what came before it, sometimes through careful observation, sometimes through outright accident, and occasionally, almost certainly, through outright failure and loss that simply went unrecorded and forgotten. The next time you take a pill to relieve a headache, or watch a doctor carefully clean and treat a wound, it is worth remembering that this entire vast body of accumulated knowledge did not begin in a laboratory. And it did not begin with any single celebrated discovery. It began in the dirt, beside a fire, beside a wounded companion, with someone somewhere entirely unknown to history, trying absolutely anything that might help, and occasionally, against enormous odds, discovering something that actually did.